Now to an interesting story that you might want to be very watchful for. Parents are being warned to take extra care in their choice of toys for their children. Experts warn that some toys are dangerous, that they can even cause the death of a child. Sharon Momanyi sheds more light on this worrying scenario.
Toys are a child's best friend. Not only do they offer positive distraction, but they also help in his cognitive, social, and physical development. However, it is emerging that some of these items now threaten to be a cause for concern. Dr. Michael Mashiro of Tenwek Hospital in Bomet explains why.
Over the past few weeks, we have been seeing a number of children who have been presenting to our facility having aspirated pieces of toys. These are locally available toys in the dukas and kiosks.
You have probably seen a toy such as this. A simple contraption that can threaten a child's life.
Because of the hole in the middle, they're able to keep breathing, which essentially saves their lives. If this thing goes down sideways, it could lead to their death immediately. And we have not seen that yet, but I would anticipate if this keeps going, we will see that at some point.
9-year-old George Aoko is currently receiving treatment at the hospital after choking from a part of his rubber toy. George is just one of more than 6 cases the hospital has received of toy-related injuries.
Most of these children are between the age of 5 to 7 years. They are older toddlers, older children, and we've seen more boys. They've all been boys.
Apart from the immediate danger posed by certain toys, there has also been concern over the presence of toxic chemicals in some toys. Researchers indicate that lead is the most common toxic metal present in children's toys, mostly through lead-based paints. Lead, which can be ingested, inhaled, or absorbed by the skin, can cause mental retardation, learning difficulties, lower intelligent quotient scores, growth delays, behavioral problems, as well as anemia, hearing loss, and kidney injuries. Other toxic components present in some plastic toys include phthalates and bisphenol A or BPA, a group of chemical compounds typically added to plastics to increase their softness and flexibility. Studies have linked BPA to the disruption of hormone function, increased breast and prostate cancer cell growth, early puberty, and obesity in humans. Lucy Wanjohi, a director at Eco Toys Kenya, explains why it is important for parents to confirm how safe the toys they buy are for their children.
By the time you get home and the child takes it, they're already grasping it, putting some parts of into the mouth, handling, and by the time you realize that that whole toy room, the negative effects it will have had, that child will already have overcome them. But then the period which he used those kind of toys is the one that brought out all many other after effects that you never even realized.
In the wake of these concerns, many governments institute tight regulations for the toy industry, with the European Union and Canada having banned BPA use in baby bottles. We contacted the Kenya Bureau of Standards in a bid to find out what standardization measures are in place to regulate the toys that are allowed in the market. But by the time of airing the news story, there was no response from the regulation body. The issue of toy safety, though a global concern, is one that has yet to take root in Kenya. The recent several reported cases, as well as unreported ones, clearly indicate that it is time to begin this conversation. Sharon Momanyi, KTN, Nairobi.